Hello cruel world, my name is Dr. Sohom Das. I'm a consultant forensic psychiatrist. I assess mentally disordered offenders for a living so that you don't have to. You can call me the ominous Sohominous. In honor of Mental Health Awareness Week, I've made this videos, which is my 6th, I believe, misconceptions about anxiety. So I'm going to tell you a bit about anxiety from the perspective of a psychiatrist. These are all misconceptions that I've either heard about directly from patients or I've read about. Firstly, I would say is that anxiety is very common in my clinical practice. I've probably treated over 500 patients with anxiety, but interestingly, because I specialize in assessing mentally disordered offenders, it's very rarely the primary diagnosis. So it's very rarely the reason that they've committed an offence. It's usually comorbid, so it's usually something in the background. In fact, I can only think of 2 occasions where anxiety has been the main disorder, and I'm going to talk about one of them later on in this video. So this video is about the misconceptions, and I'm also going to tell you specifically about my personal experience with anxiety. So sit back, relax, grab your hermal remedies, and welcome to A Psych for Sore Minds. Right, let's get started. Misconception number 1, anxiety isn't a legitimate illness. So for me, the reason for this misunderstanding, the crux of this matter, is that some people misappropriate anxiety and therefore they, or people around them, misunderstand it. So you see this really commonly in depression. Some people just have a temporary period of low mood and they think that that's depression. In the same way, some people have mood swings and they think that's bipolar, but it's not. It's so much more than that. By the way, go and check out my video on the difference between mood swings versus bipolar if you're interested, including a case example. So why am I saying all this? I think it's because when somebody experiences just a part of natural nervousness or fear and then recovers after a short period of time, they think wrongly that that is anxiety. So they can't understand why other people can't cope, and they think that people who really suffer from it are blowing it out of proportion. So I just want to be really clear, anxiety is not just feeling nervous at times. Anxiety is very different. So I'll give you some of the major differences from my clinical experience. Firstly, it's far more intense than just bog standard anxiety. You feel very fearful. You have feelings like an impending feeling of death. So you actually think you're going to die. Second difference would be that it happens in unexpected kind of situations often, so it can't be controlled like you can with some nervousness. Thirdly, I'd say that there's more physical kind of symptoms. So chest, it's not just feeling nervous, you get like chest tightening, you get palpitations, you get shortness of breath. And fourthly and finally, it's much more persistent than nervousness. So depending on how it's defined or diagnosed, the most common type of diagnoses would agree that you need it for about 6 months before you get the analysis. So what I'm trying to say is it's very different from just bog standard nervousness, and you can't equate the two. For me, if I was going to have an analogy, that's like somebody, if I sprained my ankle playing football and my ankle only hurt for 2 days, and then somebody else had a broken leg and they're in a cast, that's like me saying, well, I've had ankle pain, I know what that's like, it goes within 2 days, so their pain can't be legitimate, they must be faking it for sympathy. I think that's what some other people think anxiety is. Okay, before we move on, a psych for sore guys and gals, can you guess what percentage of adults will experience anxiety at some point in their lifetime? I'm not only asking this because I think it's interesting, but it's also related directly to one of the other misconceptions that I'll come to answers later on in this episode. Okay, misconception number 2. People who have anxiety have similar symptoms. So let me just break this down for you. I've told you before that anxiety, part of it is about feeling nervousness and fear, and obviously these are all normal human responses. So we had a fear of dinosaurs that would stop our cavemen from becoming dinner, a fear of volcanoes, stop us becoming toasts, a fear of ridicule reminds us to put our pants on before work. But that's not the problem, it's when it's excessive or when it's persistent to the point that it's not actually helpful, it doesn't help us with our survival, that is an anxiety disorder. By the way, trolls, calm down. I know the dinosaurs and humans didn't coexist. Chill the fuck out. Okay. However, there are multiple forms of anxieties. So sometimes it occurs in different situations, and even in the same situation, sometimes it can be different symptoms. Right, I'll give you a couple of examples. Probably the most common anxiety disorder is generalized anxiety disorder. So this is characterized by excessive, uncontrollable, and even irrational worrying. And that's over everyday matters like health, finances, like a fear of death, fear of your family members being safe, fear that your piles are flaring up, and workplace difficulties. By contrast, another type of anxiety disorder that I'm sure you've heard about is obsessive compulsive disorder, and that's different. So that's more about these intrusive thoughts, which are known as obsessions, and they're persistent, unwanted thoughts, and they can take the form of mental images. And there's urges that are generated, which are the compulsions, that you have to do something physically to get rid of it. So the obsessions are the feelings of anxiety. Often it's related to disgust. So often obsessions are about contamination, feeling that things are dirty, or obsessions with symmetry in OCD. And the compulsions are the need to perform certain acts or routines to get rid of the obsession. But these acts often cause distress, or they're so repetitive or sort of time consuming that they actually impair general function. So to give you an example, I remember fairly recently I assessed a woman who'd been assaulted and she developed OCD, and she would need to check all the doors on, or all the locks every time she went to bed, and all the windows had been checked, but she'd do it 7 or 8 times. So even though logically she knew that she checked it, she couldn't help these obsessive images of somebody breaking into a house. So her compulsion was to go and check the locks again, even though she knew they were locked. So what I'm trying to say is there's lots of different types of anxiety disorder, and even within the same disorders, there's different symptoms. So I've told you the symptoms, some of them before, just to give you a quick recap. Excessive worrying, restlessness, trouble sleeping, irritability, sweating, trembling, and physical symptoms like palpitation, shortness of breath, dizziness. So there's so many different kind of combinations of symptoms, and different people have them to different extents. So you might have some symptoms but not others, for example. Just give you another example of an anxiety disorder, one you would have heard of, I'm sure, phobias. So phobias, when you have anxiety about one very specific object or situation, and you do your best to avoid that particular scenario. So common ones would be like spiders, obviously flying, phobias of needles, I see quite a lot. Me personally, I do not have a fear of anything apart from fear itself and clowns. Okay, moving on. Number 3, misconception. Social anxiety is just shyness. This is a very common misconception, and the main difference is this. Shyness is like a permanent ingrained part of your personality. So if you're shy, it means that you don't want to mingle with other people and you prefer your own solitude. So if given a choice, you would avoid social situations. Social anxiety is different because the sufferer wants to interact with other people, but just the thought of doing that causes them panic, and it might be a bit overwhelming. So because of this, they avoid the social situation, but the difference is they don't want to. They don't want to be isolated like somebody who is just naturally shy. And for some people, social anxiety is characterized by an awkwardness during the physical social contact, like embracing or shaking hands or hugs or dapping up one's homies. Whereas in other people, it's actually a fear of interacting with people that they don't know altogether. And the thing about social anxiety is it only affects them at that one particular specific area or time, such as physical contact, whereas shyness is ingrained and it affects everything. Just to kind of confuse the picture and to throw something else in the mix, I'm going to tell you about avoidant personality disorder. So I imagine you've heard of social anxiety, obviously you've heard of shyness. You might not have heard of avoidant personality disorder. It is a cluster C PD, personality disorder, and it's characterized by excessive social anxiety and inhibition and fear of intimacy and severe feelings of inadequacy and inferiority. But that's the crux of it, is that the sufferers genuinely believe that they're going to be ridiculed or humiliated or rejected or disliked. So it's because of that that they avoid work situations or social situations, school activities. So it's all about this untrue or unfair fear of criticism or rejection. And sometimes it's not the case. Sometimes the sufferer even knows it's not the case, but they can't help how they feel. And I suppose the difference between this and shyness is that there's a pattern of extreme sensitivity to negative evaluation and rejection. So what I'm trying to say is it's more about this low threshold for criticism, and it's because they imagine themselves to be inferior to other people, not just shy. By the way, I did a video on what personality disorders are, and then it was quite a controversial video, and I got quite a lot of backlash by people who very reasonably actually, I think, had an issue with being labelled as having a personality disorder. So I did another completely separate video on labelling personality disorders. Links to all those videos in the description. If you're interested, go check them out. They're diggity dope. Okay, misconception number 4, anxiety is uncommon. Before I get into this, I just want to formally introduce you to my channel. This is the Psych for Sore Minds. I am Dr. Sohom, Consultant Forensic Psychiatrist. I assess mentally disordered offenders in prisons, in courts and psychiatric units. I act as an expert witness. This channel, Psych for Sore Minds, is a smorgasbord of issues related to true crime and offending. So if you like your true crime with a sprinkle of psychiatry, watch my channel. I implore you to subscribe, because not only does it help me out immeasurably, but it stops your neighbours from drilling at ridiculous crazy hours, guaranteed all your money back. On my channel, I've got interviews with different people. I dissect high profile true crime cases. I talk about individual diagnoses like this video, and I talk about some criminogenic kind of criminology issues, if that makes sense. All right, let's keep going. Anxiety is uncommon. It's a massive misconception. It's actually underdiagnosed. So many people who have anxiety won't present to their doctor or won't tell their family members because they're embarrassed about it. And I think that's because there's still a stigma attached to this and many other mental health issues, and people are worried that they're seen as weak, which to me is very odd. It's bizarre, because we would all go and see our doctor if we had like a bad back or genital warts or a broken wrist. So why are we so ashamed about anxiety? I suppose another issue, another reason that people don't present is they don't want to be reliant on medications like antidepressants, which actually act as anxiolytics, which is posh psychiatric speak for anti-anxiety. And the other thing, I suppose, is that anxiety can be persistent, but also it can present as very variable, relapsing, remitting, which means it can come and go. So I think that puts people off presenting, either because they know that it eventually will go away, so that they delay, or they're reluctant to present because they know it will go away, but the problem is it will come back, is what I'm trying to say. Okay, my schmike for small schmize. I asked you before if you can guess the percentage of adults that will experience some anxiety in their lifestyle. I have to say, I think that these statistics are pretty damn shocking. So the lifetime prevalence is, drumroll please, 33%. Specific phobias, so being scared of a very specific object, as I mentioned before, 15% in the lifetime, and social phobias 10%. So we're talking about a very, very large proportion of society that suffer with some form of anxiety at some point in their life. It's very likely, I think, that you know somebody with some form of anxiety. Perhaps they're too embarrassed to talk about it. Okay, misunderstanding number 5. Sufferers of anxiety need to avoid stressful situations. Well, we do know that certain triggers can cause stress, regardless of diagnosis, definitely. And however, I don't think it's always helpful to avoid those situations. Firstly, because it's often impractical. You can't live your life without any stress. Well, if you can, you've probably got a very dull life. And secondly, it can actually worsen your anxiety. So avoiding situations that cause stress makes you more fearful of those situations, and therefore it can perpetuate you avoiding them more. So you'll never get over it, I guess, is what I'm trying to say. Conversely, you can actually use stressful situations to your advantage, because you can simultaneously work on relaxation strategies and techniques to overcome your anxiety. So the theory behind this is that when you're anxious, you have this adrenaline response, which is finite. So adrenaline can only exist in your body for a particular amount of time, like half an hour. But if you carry on exposing yourself to the stressor and with relaxation techniques, past the point of your adrenaline response, you learn to become used to that situation. What I'm talking about is the basis of graded exposure and desensitization, which are cognitive behavioral techniques to help get over phobias, etc. And separate to all of that, some sufferers can tolerate extreme stress. And I'll give you an example. I think it's fair to say that many people would say that stand-up comedy is a terrifying prospect, getting on stage, trying to make all these people laugh. But James Acaster, shout out to James, one of my favourite comics of all time, Maria Bamford, Neil Brennan, Jim Jeffries, also very talented, are all stand-up comics who at some point or another have reported that they've suffered from some form of anxiety. I've also read the autobiography of Billy Connolly, who you might not have heard of. He's like a very old school Scottish stand-up comic. He was probably at his peak in the 70s or 80s. He also said, by the way, he would do improvised stand-up for 2 or 3 hours a night, improvising the entire thing. He would make it up on the spot, and he would do a different set every night, which is mind-blowingly amazing to think about, just the level of skill it takes to do that. But so with the confidence that he had to get on stage and do that on a nightly basis, he still said in his autobiography that he's very anxious in general in public. So he felt that he could do comedy well, but he would be anxious interacting with fans that he doesn't know, and also like public speaking. So he did a wedding speech once, and he said that he basically bottled it, and he didn't do a particularly good job, and he was nervous the whole time. So the point that I'm trying to make is, just because some people are nervous in some situations doesn't mean that they're nervous or anxious in other situations. By the way, if you're interested, there's clips of me doing stand-up comedy on the internet. I'll put links in the 𝐶𝐿 section below. Okay, last one. Last misconception is that breathing into a paper bag prevents hyperventilation. So hyperventilation, as you probably know, is where you have this rapid breathing, and it happens in some forms of anxiety, especially during a panic attack. And what happens is it can perpetuate the panic because it causes physical side effects itself. It causes palpitations, it causes lightheadedness. So when the patient experiences this, they think that they're getting worse, so the panic kind of escalates. It's like a self-fulfilling prophecy. It's a common myth that using a brown paper bag stops this cycle. It's actually there are actually much more effective methods, like breathing techniques. So counting and slowing down your 1, 2, 3, exhaling is far more effective. In fact, some people say that breathing into a paper bag, the actual paper bag itself does nothing. It's just that you're concentrating on your breathing, which is distracting. So it's nothing to do with like rebreathing carbon dioxide, which is part of the myth. So if you're having a panic attack, it's better to slow down and count your breathing. Then you don't need a paper bag, is what I'm saying. Okay, those are my misconceptions. Now I'm going to briefly tell you, in case you're interested, about my own experiences of anxiety. I've definitely experienced anxiety, as I have low mood. I don't think I've ever had the full-blown disorder. I don't think I've ever had the symptoms severe enough or long enough to get a disorder. I usually have it for a few days at a time, but I have felt anxious. For me, it's like this kind of icy tightness in my chest, which is often it feels like withdrawing from nicotine. So I've had a battle with trying to quit nicotine in various forms over many years. In fact, sometimes I relapse into smoking or vaping because I feel anxiety, although it never actually helps in the long term. And I think it's really hard for me to know because, I think my anxiety is related to work, because when I feel anxious, I'm thinking about work, and related to YouTube. So, you know, how I'm doing, well, I'm not getting enough subs, or I'm not getting enough likes, etc., views. But here's the thing, in my mind, consciously, I don't feel like I'm anxious because of those things. But those are things I think about when I'm anxious, if that makes sense. So I'll give you an example. Sometimes I go through periods of insomnia. I can't sleep for like maybe 2 or 3 nights in a row. And I don't feel like I'm worried about something. But because my brain won't switch off, I have to think about something, because you can't not think, or I can't not think. And I end up thinking about work, or I end up thinking about YouTube videos. But it doesn't feel like that's the reason I couldn't get to sleep in the first place. I mean, maybe it is subconsciously. I can't say whether it is or not, because I can't tell you something that's subconscious. But that is what I end up thinking about. So I think that's a form, I don't think I can call that anxiety, because it's not the disorder, but it's certainly a form of anxiety. So I have to say I've never sought help, and if you're wondering why I would make this video and advise my patients to go and seek help, but I don't myself, it's because I'm a hypocrite. Joking aside, it is temporary and bouts, so I assume rightly that it will always go away. What about you, dear viewers, my 𝐶𝐿 guys? Tell me about your levels of anxiety. What makes you anxious? Do you think you've got a full-blown disorder, etc.? Let me know in the 𝐶𝐿 section below. Okay. Before I finish, I just want to say my videos that I make are like my children. I definitely have my favorites. If you want to know more about what I do for a living, go check out my video on the true crime spree of Joseph McCann, one of the most horrific sexual assault perpetrators in UK history. I will put links on it in the 𝐶𝐿 sections below. Okay, I will give you a 1-minute summary, because this video is getting longer than I wanted it to, about this person who had anxiety, who I saw as a mentally disordered offender. Basically, he had social anxiety to the point that he couldn't actually work because he couldn't be around people. and he also got into gambling, made up these big debts, and he felt the only choice at his disposal was to rob a post office. So he did that. He was unexpectedly very, very anxious about this, so he drank loads of alcohol to help with his nerves. He did a really botched job. He actually had an imitation handgun, I kid you not, and he painted one end of it, which was bright red. It was like a toy plastic gun, painted one end of it, which was bright red with black marker. And the reason he got caught during this robbery of a post office was that the ink was coming off in his hand. One of the post office workers saw, wrestled him to the ground, beat him up. He got arrested by the police. And the reason I'm mentioning this is this one of the very rare cases of the hundreds of mentally disordered offenders I've assessed. It's one of the only cases where anxiety was the main disorder that caused the guy to offend. So we had to rehabilitate his social anxiety, which we did over many months during his time in a psychiatric hospital. So he ended up there rather than prison, and we helped build up his confidence and eventually trained him up as a waiter and a barista whilst he was in our hospital, so that he had opportunities once he got discharged, so he wouldn't offend. That is quite a soft case, so in terms of the level of violence, it was not particularly that high compared to most of my cases. I see everything from child molesters to people that kill family members. If you're interested, I'm going to shamelessly plug my book, Into Minds, where I go through loads of my cases. It's partly autobiographical as well. I talk about my journey of becoming a forensic psychiatrist, and the cases are a lot more juicier than the ones I've told you about. That case didn't make it into the book because it's not that exciting. I'm only mentioning it because it's very relevant to anxiety. Okay, I think I'm blabbering, so I'm going to say goodbye. Come see me at CrimeCon, one of the biggest true crime conventions in the UK. You can get 10% off if you use the code PSYCH, which will be in the description below. Until next time, stay euthymic. Do not forget, I love you.